Good evening, everybody. We have finished the topic of mental diseases in last lecture. I think since last 2 months we are discussing about the mental diseases and their homeopathic management. And Hahnemann sir have tried his level best to explain the types of mental diseases and a proper approach to treat them. At the concluding part, since last 3 days we were discussing regarding last three aphorisms related with it, explaining the mental regimen towards the first type of mental diseases. What a physician should do, how he should behave, what he should not do, and ultimately to conclude that homeopathy is the only method which is able to treat such types of mental diseases. The obsessive compulsive neurosis, anxiety, depressions, paranoid schizophrenia, such varieties of disorders which comes under this type of first variety of mental disease and their homeopathic management we have learned in detail. Now he starts with one more aspect, that is the biggest disorder which happens to be there in day-to-day practice, and those are called as the intermittent diseases. So what exactly mean by intermittent diseases? We know the intermittent fevers commonly, but we don't know exactly what we mean by intermittent diseases. So intermittent fevers are the one of the types of intermittent disease. So what exactly Hahnemann wants to say about intermittent disease? He starts with aphorism number 231. So today we'll start with this intermittent diseases 231 to 244. These are the aphorisms dedicated for the intermittent diseases and their homeopathic management by Hahnemann. So we will start with exactly what he wants to explain about intermittent diseases. The intermittent diseases deserve a special consideration, as well those that recur at certain periods, like the great number of intermittent fevers and the apparently non-febrile affections that recur at intervals, like intermittent fevers, as also those in which certain morbid states alternate at uncertain intervals with morbid states of different kind. So here he tries to explain the exactly what he wants. What do you mean by the intermittent disease? Intermittent diseases where certain diseases which appears, then at certain period they disappears, then again reappears. The in-between period they touches to the normal, like an intermittent fever. Those diseases he labeled by the name of intermittent diseases, or sometimes certain diseases where one disease state alternates with another disease state. So one disappears and another state reappears. Again that disappears, the original state reappears. Those are also one type which he labeled by the name of alternating diseases later. That also forms the type of intermittent diseases. So here he never wants to explain only about the intermittent fevers, but in broad, the intermittent diseases. And intermittent diseases are very commonly we get in our practice. Generally, we never give so much of attention to the patient's complaint. If we start giving the attention to the patient's complaint, then we get the remedy. And when because we get that alternative states are hidden in the patient's history, we miss many a times remedy. It has happened with in early of my practice, nearly about 20, 25, 30 years back, very early state of my practice. The patient was coming to me with a severe anemia due to the blood loss, due to the hemorrhoids, bleeding hemorrhoids. And I used to treat him regularly. And he used to get settled with proper homeopathic remedy. And he used to settle with whatever remedy at that time I used to use for him, and he used to get settled, and bleeding was stopped, and anemia recovered, And after some time, he started getting the rheumatic complaint. So he came later with rheumatic complaints. So again, I have worked out with the case. Then I found certain remedy. I have given rheumatic remedy, and he recovered. For time being, he was very settled, and he recovered again the hemorrhoids. So this has happened consequently to 3 times, and then I understood there is alteration of the symptoms, alteration of the rheumatism with the hemorrhoid, which is happening in that patient. Then I worked out with this case, and that fellow very clearly settled with the abroten, where these two states were alternating with each other. So this you have to understood very clearly in patients. Many times we miss this because we generally look towards what is the presenting state of the patient. And if we miss this, and many times patient doesn't understand that this is alternative. If he understands, he is intellectual enough. But if he is not that much intellectual enough, it is you have to look towards certain things. And such a things happens many times. And we have ample remedies for alternating states. Opium is the remedy where you get many alternating states. Then you have Dalkamara, where you have rheumatism alternating with skin complaints, asthma alternating with skin complaints. There are many more remedies where you get the alternating states in homeopathy. So intermittent diseases plays very vital role. With the help of homeopathy, we can treat such types of intermittent diseases. So we have to understand basically the types of intermittent diseases. So here he explains intermittent diseases are there. They are either there is a disease which appears and certain state it disappears and again reappears, called an intermittent disease, or another variety where certain morbid states alternate with at uncertain intervals with morbid states of different types. That also he has included in the intermittent disease, to which he labeled by the name of alternating disease. So that he explains in aphorism number 232. So he starts with that first variety of intermittent disease, to which he labeled by the name of alternating diseases. Those who are the students, they should just write it down that there is short note on alternating diseases on this topic. And this whole topic, right from aphorism number 231 to 244, in full question on intermittent diseases. How Dr. Samuel Hahnemann have explained about intermittent diseases and their homeopathic treatment, explained in detail. So this topic is also useful for exam point of view. So we'll start with aphorism number 232. These latter alternating diseases are also very numerous. Latter means those which are explained over there in earlier aphorism at the latter place, means that is the alternating disease. So what it says that these latter alternating diseases are also very numerous, but all belong to the class of chronic diseases. So he says they are not of an acute character, they are always belongs to the chronic diseases. They are generally a manifestation of developed sora alone. So he explains the cause behind it. First cause he explains they are because of developed sora alone. That is the first cause behind the alternating disease. And second cause which he explains, sometimes but seldom म्हणजे क्वचित, sometimes but seldom complicated with syphilitic miasm. Sora alternating with syphilis. That is the tubercular miasm. And therefore, in the former case, that is in the soric case, may be cured by the antisoric remedy, but in the latter, that is sorosyphility. However, in the alternation with this antisyphilitic, as taught in my work with the chronic diseases. So, if that is a pure soric case, yes, you have to give the antisoric remedy. But if it is not a purely soric, but if you find it out that it is a sora alternating with syphilitic miasm over there and which produces this end, alternating disease over there, then you have to alternate antisoric with the antisyphilitic remedy in order to bring out the cure. Hahnemann explains this aspect because the remedies were very less in number during Hahnemannian time. Now we have ample remedy. We have the remedy which have the whole state of which covers by the remedy. There are remedies where the alternating symptoms are present, alternating diseases are present in single remedy also. So many times these practical applications mentioned by Hahnemann never requires. We used to get a remedy which covers both alternating states in one patient. And then you can prescribe that remedy. So keep it in your mind that not only Hahnemannian aspect, but our modern aspect looking towards our materia medica and correlating it with the intermittent disease, we have to understand. When we read the materia medica, always correlate it with the organon of medicine. If you open opium from the Borix materia medica, see what he says in the first sentence. Very important sentence which is mentioned by him. Just a minute. This is the only remedy where you get maximum alternating state. How he starts opium in Boris remedy? Hahnemann says that it is much more difficult to estimate the action of opium than of almost any other drugs. And why he says? Because there are many alternating states. You cannot fix on one state. And that's why it is very difficult which state is predominating in opium patient. We have such types of remedies in our material. And that's why many times we don't have to do these permutations or combination of antisyphilitic alternating with we can get a remedy where two states alternate. If we open the abrotanum, we have alternating symptoms in abrotanum, alternating disease state in abrotanum. Dalkamara, we have alternating states. So we have to read materia medica with this approach. Then it is quite easy to reach towards the remedy. And if we get such types of states, then it is quite easy to get ideal cure in such types of patients. So this is what he wants to explain over there regarding the first variety of intermittent diseases called as alternating diseases. Examples of alternating diseases are mentioned in the footnote. Footnote is related with this same paragraph, which are alternating diseases, footnote number 127. Just go through that footnote. He has explained many examples of alternating diseases. 2 or 3 states may alternate with one another. Thus, for instance, in case of double alternating diseases, certain pains may occur persistently in the legs, etc. Immediately on disappearance of a kind of ophthalmia, which latter again appears as soon as the pain in limbs has gone off for the time. So he has given one example of ophthalmia alternating with the pain in legs. So that is the first variety, first example which he has given. Second example which he has given, convulsions and spasms may alternate immediately with any other affections of the body or some part of it. What he says over there, second example, convulsions and spasms may alternate immediately with any other affection of the body or some part of it. See, this is second example. One side convulsion disappears, some bodily pain or some bodily complaints appear. In a case of threefold alternating states, means one state, second state, and third state alternate with each other. In a case of threefold alternating states, in a common indisposition, periods of apparent increase of health, and unusual exaltation of corporeal and mental powers, Exaltation means it is going beyond limit. Exaltation, atyananda, atishay jasta pramana. Exaltation of corporeal and mental powers, extravagant gaiety, extravagant beyond limit, gaiety, anandipana, extraordinary activity of the body. So mind is so active, very extraordinary activity of mind, excess of comfortable feeling, inordinate appetite, so very marked appetite may occur, after which, and quite unexpectedly, gloomy, gloomy म्हणजे खिन्न, उदास, melancholy, sad, humor, मनाची वृत्ती, intolerable hypochondriacal derangement of the disposition. Hypochondriacal. Hypochondriacal means patient who himself feels that he is diseased. He is not normal. Intolerable hypochondriacal derangement of his disposition. With the disorder of several vital operations, the digestion, sleep, etc. appear, which again and just as suddenly give place to the habitual moderate ill health. See, three states. The first, very active mind, happy mind, very exaggerated happiness is there. Then patient becomes sad, absolutely in opposite state. And then third state, it disappears, and again patient becomes physical, having physical disorder. So this is threefold alternating disease. And such states are present. We generally never understand what is happening with the patient. This is so important to understand that patient is getting recovered from one state and he enters into the second state, again recovers from the second state and enters into the third state. So this is what is happening over there. Then further what is this? Another example. When the new state comes, its appearance, there is often no perceptible trace of the forward one. In intermittent diseases, this happens many times. One state disappears, it disappears completely, as if there was nothing, and something new comes. Again, that which disappears, and again the former comes. So this happens many a times. Few of the symptoms of the first state remains on appearance, and during the continuance of the second. What he said? Sometimes few symptoms of the previous one remains, and the new state comes. Sometimes the morbid alternating states are quite of opposite nature. As for instance, melancholy periodically alternating with gay insanity or frenzy. So sometimes it is exactly opposite state which can appear. So happy person, gaiety person suddenly becomes sad, gloomy. Cheerfulness alternating with sadness. You can get that rubric in your repertory also. So such states are quite common. And such disorders comes under either they are soric or either they are syphilitic in nature. Generally, they are the part of purely soric, or they are generally the part of soric alternating with the syphilitic. And these, how to treat those disorders, that we have to understand very clearly. So we have finished two aphorisms in today's session. Aphorism number 231 as well as 232. The first variety of intermittent diseases, that is the alternating diseases, which we have discussed. Tomorrow, we'll start with the next variety of the intermittent disease called as typical intermittent diseases. So we have to understand all those diseases along with the different examples from the books, from the Materia Medica as well as, and we have to understand exactly what Hahnemann wants to explain, how he wants to tell you exactly the approach in treating those intermittent diseases. That is very important from practice point of view. So that's all for today. If any query is there, we can have a chat. Otherwise, we'll conclude the meeting. Any question, query regarding this, regarding patients? So no queries are there. So we'll conclude the meeting and we'll meet at the same time tomorrow at 6 o'clock. Thanks a lot. Thank you, everyone.